Hi everyone, welcome to my YouTube channel. I'm Dr. Samin. Here I share simple and educational videos about sexual and reproductive health to help you learn more about your body. If you want to improve your knowledge, stay with me until the end of the videos. Don't forget to subscribe, like, and leave a comment to support my channel. Let's learn together. Many people don't realize that anal intercourse is considered one of the high-risk forms of sexual activity. And the reason comes down to anatomy. Anal intercourse involves stimulation of the anal area, which some people may find pleasurable. However, it's important to understand how this part of the body is designed and why extra caution is needed. The anus is located at the end of the digestive tract and is connected to the rectum, which is responsible for storing and passing stool. The anal canal is controlled by two muscles called the internal and external sphincters. The internal sphincter works automatically while the external sphincter allows voluntary control over bowel movements. One important thing to know is that the lining of the rectum is very delicate. Unlike the skin around the outside of the anus, this tissue is thinner and more vulnerable to small tears or injuries caused by friction or pressure. This is very different from the vagina. During arousal, the vagina naturally becomes more elastic and produces lubrication, which helps reduce friction during intercourse. The anus, on the other hand, has a more limited ability to stretch and does not naturally produce lubrication because its primary function is bowel elimination, not sexual activity. Another important thing to understand is that the anal sphincter muscles are designed to keep the anal canal closed. Because of this, these muscles may naturally tighten during anal intercourse. This can increase friction and may lead to discomfort, pain, or small tears in the delicate rectal tissue. The risk of injury becomes even higher when anal intercourse is rough, forceful, or performed without adequate lubrication. In this situation, deeper tears, bleeding, and significant pain can occur. Anal intercourse may also increase the risk of certain infections, especially if proper protection is not used. The risk can be even higher. Vaginal intercourse takes place immediately afterward without changing condoms or practicing proper hygiene. Repeated anal intercourse may also affect the muscles and nerves around the anus over time. In some cases, this may contribute to reduced bowel control or fecal incontinence. Anal intercourse can also worsen existing conditions such as hemorrhoid and may increase the risk of anal fissures. In rare cases, serious injuries to the rectum can occur, may require emergency medical treatment. For men, bacteria from the digestive tract may enter the urinary tract and increase the risk of certain infections. So, how can this risk be reduced? The safest way to avoid these complications is to avoid anal intercourse altogether. However, if someone chooses to engage in anal intercourse, there are several important precautions to keep in mind. First, always use condoms and plenty of lubrication. Second, if you switch from anal intercourse to vaginal intercourse, always use a new condom. Third, never force penetration. And finally, if you experience bleeding, severe pain, fever, or other concerning symptoms, seek medical attention as soon as possible. And that's it for today's video. Thank you so much for watching all the way to the end. I hope you found this information helpful. If you enjoyed this video, please consider subscribing to support the channel. Don't forget to like the video and leave your question in comments below. I do my best to read and answer as many as I can. Thanks again for being here. Take care and I'll see you in the next video.